On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hi, welcome. It's Thursday evening, and this is your appointment with your doctor. This is Talking with Dr. Donna. I am Dr. Donna White-Carey. Thank you so much for joining us tonight. Tonight we have a very special guest. We are talking with Dr. Carrie Ann Kelly, who is an obstetric gynecologist here in the Oakland Bay area. And we're going to talk about some lady stuff. It's Women's History Month, so we're going to have a little women's stuff tonight. We are talking about the joy and the pain of the uterus. For all of those ladies out there who are watching who has a uterus, I know you know what I mean. The joy and the pain. So I'm excited and can't wait to have Dr. Carrie Ann Kelly join us. But first, I want to thank you again for joining, and I want to talk about the purpose of Talking with Dr. Donna. As you know, if you've been on my show before, you've heard me talk about my focus of building generational health. And what does that mean? That means looking at our community and paying attention to our emotional and mental health, our spiritual health, our environmental health, and our physical health, because all of these pillars of health impact our physical health. And that impacts the health that we pass along from generation to generation. And I want that health of generation to generation to be better each generation, healthier, happier, in less health disparities from generation to generation. We're going to talk a little bit about coronavirus tonight too. So first, let's do some updates on coronavirus, because as you know, there's been a lot of things in the news, a lot of things happening still with this pandemic. Here we are a year later, and we are still dealing with this pandemic. It has not left us completely, although thankfully, it seems like we are starting to see a decrease in our numbers. But we know that we still need to be vigilant. So I want to first put up this slide with our cases and our deaths. So as you can see, we are still having people test positive for coronavirus. Over 1,000 deaths in Alameda County. I want you to pay attention to the two lines that I ask you to pay attention to every week that I show this slide, and that is who, in terms of our age demographic, has the highest number of cases. That hasn't changed. The 18 to 40-year-olds continue to have the highest number of cases in our county. And I also want you to look at the cases by death. And we look at, of course, communities of color, Black people, Latinx people having the highest rate of deaths. Now, again, we're not looking at hospitalizations, but if we were to look at hospitalizations, we would know that the same ethnic groups that have the highest rate of deaths also have the highest rate of hospitalizations. All right, let's look at the next slide. Our next slide, I want to contrast the highest number of cases to the highest rate of deaths and hospitalizations, and contrast that to who's getting this vaccine. Now, I know there are lots of you out there who are still thinking about the vaccine. I'm not going to say that you're hesitant to get the vaccine. I don't like that term at all. Do not think that vaccine hesitancy should be something that we are really concerned about. I've been calling it wisdom, right? Because there has been a long documented history of the medical and scientific community doing wrong by Black and brown people, very simply. Experimenting without our consent, experimenting even without our knowledge. We know that. And so when there's a new virus that comes out and new technology used in a vaccine that's never been used before, and it's done in record-setting time, I don't call that hesitancy in a negative way. I call that wisdom to say, wait a minute, what's in that? How is that going to impact me? And should I get it? So I call it justified distrust because of the newness of the vaccine and because of the way in which it was developed and the rapidity, right, with which it was developed. It's smart to ask questions. I never fault anybody who wants to ask a question about the vaccine. But once you have that knowledge and information, then you can make a decision for yourself, all right? But if we look at who's getting vaccinated, we know Black and brown people are dying at a higher rate. They're being hospitalized at a higher rate. But when you look at who's getting vaccinated, we're not getting vaccinated at a higher rate. That's not cool. That's not what we want to see. So there are lots of things in place to help with our vaccination. One of the things that my church, True Vine Ministries, we have partnered with Lifelong Medical and with FEMA and Cal OES, which is the the Governor of California's Office of Emergency Services. And we are providing free vaccines right here at True Vine Ministries starting tomorrow. We are having vaccinations every Friday, every Saturday, every Sunday, every Monday from 9 a.m. to 4 p.m. at 896 Newton Carey Jr. Way. That is our institute, our office building on the corner of West Grand and Newton Carey Jr. Way. We are having free vaccines, 9 a.m. to 4 p.m. I highly encourage an appointment. So you call that number, get an appointment. If you don't have an appointment, we are taking walk-ups, but I highly encourage an appointment. So if you're interested in getting the vaccine, want the vaccine, come on down 9 to 4, Friday, Saturday, Sunday, and Monday every week through April the 5th. That's a bit of a typo on our flyer, but through April 5th, okay? This starting tomorrow. Last weekend at our immunization site, we had Pfizer vaccine, but starting tomorrow, we are going to have the Johnson & Johnson vaccine. What's the difference? The Johnson & Johnson vaccine is one dose. So one shot, that's it, and you're done. Is it as effective as Pfizer and Moderna? It's 100% effective against stopping you from dying. That's what they say, 100% effective. You get this vaccine, if you get exposed to coronavirus, death, it's not going to come knocking at your door from the vaccine and from the virus. So yes, we want you to get this vaccine. Johnson & Johnson vaccine is a much more of a regular, typical type of vaccine that we're used to seeing. And it's not using the new technology like was used with the Moderna and the Pfizer vaccine. This is using an adenovirus, which is another type of virus like the common cold. It's using that virus as a carrier to bring it into your cells. And then just like the other vaccines, it tricks your body into producing the spike proteins. Those are those little crowns on the surface of the virus. And then your antibodies kick in, your body starts to attack those little crowns, and voila, your antibodies are activated. You now have memory. And so when if your body does come into contact with the virus itself, the real coronavirus, then your body is prepared to start to fight it. So come on down, get your vaccine. If you're interested in having a talk and chat before you get the vaccine, there will be doctors on site to help answer your questions. All right. So as I mentioned, it is Women's History Month. And I want to pay homage today, since we have a fabulous OBGYN here today with us. I want to pay homage to all of those women who dedicated their lives to science unbeknownst to them. They were slaves who were experimented on to develop some of the gynecologic surgeries that we currently have. The man who is considered the, quote, father of gynecology got a lot of his information by experimenting on black slave women and their bodies. And so while I don't want to give him any credit, I'm not even going to tell you his name, you can Google it if you want, I am paying homage tonight to all of those black women who suffered and braved his experiments to get to the information that we have today. So that is who I'm honoring today as we bring on our OBGYN, Dr. Carrie Ann Kelly. So let me tell you about Dr. Carrie Ann Kelly. She has her MD degree, so she's a medical doctor. She also has a master's in public health. And she deserves the distinction of this honor as a leader who advances health equity through her dedication to incarcerated men and women. She makes a tremendous impact on the community she serves by fostering partnerships to streamline existing programs. She completed a Doctor of Medicine degree from Morehouse School of Medicine. I know a few people out there know about the house, where she received several merit scholarships for academic achievement and graduated cum laude. After medical school, Dr. Kelly interned at SUNY Downstate Medical Center and then completed her OBGYN residency training at Santa Clara Valley Medical Center right here in the Bay. She practices as an OBGYN within Alameda Health System in Oakland, California, and serves as a volunteer clinical professor of UCSF School of Medicine. And she is the director of the Women's Reproductive Health Equity Fellowship. That's an initiative to train OBGYNs to investigate and study health disparities in women's health. All right, all the talking with Dr. Donna fans and folks, let's welcome Dr. Carrie Ann Kelly to Talking with Dr. Donna. Welcome, Dr. Kelly.
Thank you for having me.
Thank you so much for being here. So it's Women's History Month, and I talked a little bit about who I'm paying homage to tonight, all of those slaves who gave their life for us to have some advances. What do you think about that?
Well, it's an unfortunate truth in women's history, and I am always honored, and since I was 12 years old, I've wanted to be an OBGYN. So I am, it's a humbling experience. I am a feminist, I'm an advocate, and I'm happy to be here, and let's celebrate.
Yes. Well, we are happy to have you too. We know that our Black doctors matter, so I know it's a great thing for people to come in to Alameda Health System and to see you as their OBGYN. So let's talk about the joy and pain of the uterus. The joy, of course, is that the uterus brings life. It holds life and can bring forth life. The pain, I think, particularly for a lot of African American women, is fibroids. Yeah. So what are fibroids?
Oh boy, that is a very loaded question. So, as you said, joys and pains, the uterus is a beautiful vessel that vast majority of women are born with. And sometimes that vessel can have growths or problems that come about that's not necessarily normal. So uterine fibroids are non-cancerous growths that develop from the muscle tissue of the uterus. They can also be called leiomyomas or myomas, and they can vary in size, location, and shape. Sometimes they're on the inside of the uterus where the baby would sit, or other times it can be on the surface or a part of the cervix. It can also be in the muscle of the uterus. It can also be attached from like a stalk, all right? It can vary in size from very few millimeters or as big as a watermelon, okay? And sometimes they don't grow and sometimes they do, and that portion is very unpredictable.
Mm. So you talked about all of the different places where the fibroids can be. Is there any place where it's worse being in one place versus another, or does that matter?
Okay, it really depends on what worse means for you. Uterine fibroids are extremely common. About 20 to 80% of women across their lifespan will develop fibroids. They don't really mean much unless they cause problems. So, what problems can they cause? So, the most frequent complaint that women come with are changes in menstruation. And then, menstruation is just that time during the month where you shed blood and tissue from the uterus when you're not pregnant. So sometimes your menstrual period or your period can be longer, it could be more frequent, or it could be really heavy. It can cause cramps, it can cause pain, it can cause vaginal bleeding at other times outside of menstruation. And then it can cause a low blood or red blood cells, which we commonly refer to as anemia. It, depending on the location, it can cause infertility, it can cause miscarriages, painful. It can be pain can be caused during sexual intercourse, or maybe when you go to the bathroom, it hurts to go to the bathroom, do a number one or number two. You're urinating and it hurts. There's a lot of
Hmm.
pressure there. Or you're having a bowel movement, it hurts. There's a lot of pressure there. So it really depends on the location of the fibroid, the size of the fibroid, and if it causes problems. Sometimes it doesn't. We find fibroids because we were looking for something else and it just kind of popped up on that CT scan you had because you had abdominal pain, but really you have liver problems, or it popped up on the ultrasound during pregnancy when you were just trying to look at the baby. But unless it's causing symptoms, problems for you, it's interrupting your daily activities of living, then uterine fibroids typically is not something that you worry about.
All right. So you said like 20 to 80% of women can get fibroids in their lifespan. It seems like though, like African American women, we have like almost everyone I know will say they have fibroids, or it seems like it's so common in our community. Is that just the people I know, or is that a fact that African American women have more fibroids or tend to have fibroids? And if so, why? What is that about?
You know, Donna, sometimes it's just hard being Black. It's just one of those facts that we
Yes,
know.
yes, we know.
So yeah, it is true that fibroids in general are very common, and it's mostly common in women in their most fertile years. So like usually late 20s, 30s to 40s, but it really can occur at any age. And we know that fibroids occur more often in African American women than in white women. Genetics. It's multifactorial, but genetic. So if your mother or your sister or your grandmother had this history of fibroids that were problematic for them, then you're probably predisposed to having that history as well. But again, it's not 100%. You may not. It's just something to keep in mind during your cycles, and then if any problems arise.
All right. What do you do with fibroids? Are there lots of treatments, or one treatment, or any treatment for fibroids?
Well, there are various treatment for fibroids. Again, if it's not broken, don't fix it. All right. Just because you find a fibroid doesn't mean you treat it. It has to be causing some sort of problem. So typically with fibroids, what sort of problem is it causing? Is it causing bleeding? Okay, there's a treatment for that, treatment for bleeding, and it may be hormones, it may be surgery. Is it causing pain? The first line usually is pain medication. Is it that severe? Now, if you want to treat fibroids directly, then and it's causing an issue, you usually have options to remove the fibroid, and that's a surgery, or it's called like a myomectomy. Okay, that's just a removal of a fibroid, and that can be done through various avenues. Sometimes, you just want to get rid of the entire vessel. You don't even want to have the possibility of having fibroids. So then you remove the uterus. That's what a surgeon would do. And that's called a hysterectomy. Okay. There are other treatments that have been studied on how to treat fibroids, and you can use lasers, you can use ultrasound waves. Those are sort of fancy ways to treat fibroids. You can do things like uterine artery embolization, where there are these tiny particles that are placed in your blood vessels that feed that fibroid, and those tiny particles cut off the blood flow to that fibroid. That's the goal. But of course, you can cut off the blood flow to other things. So the treatment of the fibroid really depends on the symptoms and what your ultimate goal is. Do you still want to try to have children? There's some treatments you shouldn't go through, or are you done with childbearing? And then there are other those treatments you should talk to your doctor about.
That's great. So I'm looking at the chat. If you're watching live with us and you have a question for Dr. Kelly, go ahead and put it in the chat. I am monitoring the chats to see if there's any questions for Dr. Kelly. We do have one question that says, once the fibroids are removed, can they return?
Unfortunately, they can return. They can return, unfortunately. So if you have a fibroid and you want to remove it, if you are a woman of childbearing age and you have these wonderful hormones pulsing through your body, that estrogen that makes your face glow and your skin so supple, it can come back. Fibroids love hormones, and that's really what feeds the fibroids. So, to permanently remove a fibroid, you would remove your uterus. If there's no vessel, then the fibroid won't grow, right? Also, another way that typically fibroids stop growing or shrink is when you hit menopause. So, menopause is when you don't have a menstrual period for essentially 1 year. And so your hormones, that the estrogen and progesterone that we love in our youth, it kind of really dwindles down and it really gets cut off. So, our skin wrinkles a little bit, we get a little dry in certain areas. Bad for that part, but great. Not feeding fibroids anymore, to not feed the fibroids. So that's another way where your fibroids can shrink and then not regrow. It's very, very uncommon for someone who's in menopause to have a fibroid that's growing. That doesn't really make sense, right? You cut off the nutrients. And so then we look into other things. If someone who's in menopause says, my fibroids are growing, that's unusual. That deserves some investigation.
So are there any other associations with fibroids? The other things that you need to look out for if you have fibroids, or are they independent?
That's a great question. They're really independent. However, some things that I don't think many women talk about or consider when thinking of fibroids is your diet, right? Everything that you put in your body kind of affects how it works. And so if a woman would like to minimize her symptoms from fibroids, then there are certain foods she should avoid. So for example, any high fat processed meats, any high fat dairy, they have a lot of hormones. They can have a lot of hormones and estrogen that then feeds those fibroids, like we talked about. Salt has known to affect hormone levels. Effects of your diet, of an unhealthy diet on your liver. And your liver is the organ that is most responsible in clearing all the toxins out of your body, and it helps to balance your hormones. So for someone who, drinks a lot of alcohol or ingests substances that can affect their liver, that can also affect the hormone level. And so diet is very important if you're looking for natural ways to, decrease symptoms from your fibroids. Then that's a very healthy and natural way to decrease the symptoms of your fibroids. Also, I want women to think of like refined carbohydrates can change and alter your estrogen levels. So things like pasta, white bread, white rice, cakes, cookies, all the things
Oh, you're killing me.
that we love to eat, in moderation. But if you're having issues with fibroids, then it's probably in your best interest to cut those things out. Eat green leafy vegetables. Eat unprocessed meats, things very, very low in fat. All of those things can be helpful in reducing the symptoms from your fibroids.
Do they do any, I know you said they reduce the symptoms of the fibroids, but they don't actually take away the fibroids, or do they impact the fibroids at all? Or is it more the symptoms of the fibroids?
Well, once you change the hormone levels, if the hormones aren't available in abundance, then it can't feed the fibroid. So there's always a possibility that, you decrease your estrogen, just like the natural way to decrease your estrogen, or the way that your estrogen decreases is through aging, right? Menopause. So then your fibroids shrink. Most of the time, that is exactly what happens. And so any food that alters your estrogen in your body can then serve as fuel, right? It's the estrogen against the fuel to feed these fibroids, but it doesn't decrease it directly in that way. So there's not a food that you can eat and say, oh, my fibroids are going to shrink. No, that's not going to happen. It's an overall effect of the hormones in your body, and that's what will affect your fibroids. Now, there are medications that we use as gynecologists for patients who want to shrink their fibroids in preparation for surgery. Okay. You may have heard of like Lupron. It's a common medication that we often use to shrink a huge fibroid. Like imagine someone who's pregnant at 38 weeks, it can get that big, right? And so to have a hysterectomy, let's say this woman is finished with childbearing and they're like, just take this vessel out. I don't want this ever to regrow. Then most gynecologists would use a medication that would cut off your hormones. The problem with that is, if anybody has gone through menopause on this feed, is that sometimes that's not a pleasant experience. You can get night sweats, hot flashes. You just feel really, really crummy. And so because this medication is cutting off your hormones, you can get that side effect. But it does shrink that fibroid pretty small. So then we can take it out through surgery, through tiny little holes that we put in your abdomen, and then, remove that vessel because it's connected to your vagina. And we just close that up, and that's that.
Wow. Does weight have anything to do with fibroids? Your weight?
Absolutely. So remember I talked about diet, all those good things we love to eat usually add to our fat, right? And so our fat cells sometimes convert that fat into estrogen. So being very overweight or very obese at the baseline compared to someone who's not, you have higher amounts of estrogen roaming around in your body. Okay. It's an esterification process that happens in these fat cells. And so for obese women, it's not uncommon to have a lot of fibroids. And so that's why your healthier diet is very important, keeping your weight down to a normal weight. And when I say normal weight, body mass index, that we think is a normal between 18.5 and 24.5.9. So weight is important, diet is important, genetics we can't change. We can just help to combat the things that we can change that are modifiable.
Can you still have children if you have fibroids?
Location, location, location. So it all depends on the location. So I want you to think of your your uterus as a vase. All right. Inside that vase is where that baby is going to sit. If you have fibroids or any growths there, it can really potentially affect your ability to not ovulate or not have that egg fertilized, but that once that egg is fertilized, to implant inside that vessel. that fibroid can disrupt that. A polyp, which is a overgrowth of tissue, not muscle tissue, can also affect that. It can sometimes block your fallopian tubes. Okay, so your fallopian tubes connects to your uterus. It's really hard for that fertilized egg to get to your uterus to implant if it's blocked. So location is the most important thing when you're talking about fibroids. Location, location, location. So it can result in infertility and an inability to become pregnant, or it can also result in miscarriages, meaning that you did get pregnant, it did implant, but you were not, your body was not, your uterus was not able to hold on to that pregnancy. And because fertilized egg that turns into your embryo needs to connect to the inside of that vessel and get fed with nutrients, right? And so if that connection is disrupted, then it results in a miscarriage. When we're talking about fibroids, there are a lot of things that can result in a miscarriage, but that's a way that a fibroid or a growth inside the lining of the uterus can affect fertility and result in miscarriages.
Okay, well, I heard that all hope was not lost, that even if you do have fibroids, that you can still carry a child, just depends on the location of those fibroids.
Yes.
If those fibroids are if you get pregnant and those fibroids, the baby grows and those fibroids get in the way, like, what do you do in that case with your pregnant mom with fibroids?
Well, if you're a praying person, you can pray about that.
Yes.
Once that pregnancy starts growing, there's nothing that we can really do that will not potentially disrupt that pregnancy. So it's just, being hopeful that that baby is able to grow despite that fibroid being there. But ideally, if you know a fibroid is inside of that vessel, as I mentioned, and it may affect fertility, your doctor may advise you to maybe remove that and then try to get pregnant immediately. Your chances increase of, first of all, that fibroid likely not growing back that quickly. And then if it does grow back, not in the time frame that, that a small fetus would grow, right? And so that might be an option for a woman who they have fibroids in that vessel. Just remove it and try to get pregnant.
All right. Thank you, Dr. Kelly. The joys and pains of uterus. I think it's beautiful for us to be women, to be able to have the opportunity to bring life in. And that's the joy of having the uterus. But definitely there are some issues that come with having a uterus, fibroids being one of them. Any last words or comments that you have to say about the joys and pain of our uterus?
Well, our uterus is our friend. Sometimes it can be our enemy. But just know that if you do have problems with your uterus, bleeding, pain, you're not alone. Don't feel as though you're abnormal in any way. Unfortunately, it's just one of those challenges and trials and tribulations of being a woman and having those organs. And you can get help. And if you do not like the advice that your doctor is giving you, you can always get a second opinion. So remember that doctor-patient relationship, it goes both ways. So you should feel comfortable in talking to your doctor, having that wisdom, doing your research. I love Google, but Google didn't go to medical school. So I'm going to encourage all women on this call today, on this stream, to do your homework, but then find a doctor that you can trust. Find a doctor that you can bond with, that you can have a good doctor-patient relationship with. If that doesn't work out, you can get a second opinion and a third opinion. But just keep in mind that if all the doctors are saying or recommending something similar, that's probably the most sound advice that you can get.
That's awesome. I love that. finding the right doctor. I talk about that all of the time. If you can't talk to your doctor, you have the wrong doctor. Find someone that you feel comfortable with sharing your like all of everything, your secrets, your thoughts, your fears, all of those things you should be able to share with your doctor.
Absolutely. Sometimes you have to say some things that are sensitive, embarrassing, but your physician is not there to judge you. We're here to listen. We've heard a lot of things that might seem a little crazy. I think we're used to that. But find that relationship that you can just really be honest. We do need you to be honest. We do need to take care of you as a whole person. And I think that's really important to have that relationship with someone that you trust to take care of you and help you make decisions for yourself.
Absolutely. Before I let you go, I want to just remind everyone that even though we're in the midst of the pandemic and we're talking about coronavirus, and that seems to be what we're so focused in on, I want to encourage you to not forget about your basic health that you need to take care of. So you still need to get your mammogram. You still need to go and get your pap smear if that is appropriate for you. You still need to see your doctor. So don't let your regular health fall aside because we're dealing with this pandemic. Anything you want to say about that, Dr. Kelly?
Absolutely. I do understand and I empathize with everyone who's had delayed care because of the coronavirus pandemic. And obviously, this is a virus that was unknown to anyone. There was a lot of confusion in the beginning what to do. But again, I believe in science, and the scientists kind of had to figure it out. So a lot of the recommendations change. One of the things that was happening was we weren't able to get into the office. We didn't want anyone to come around. We didn't know what to do. It wasn't urgent to get your pap smear. It wasn't urgent to get that screening mammogram. I think, however, what I would recommend at this time, if your healthcare provider is not providing that opportunity, stay on top of them. When can I come in the clinic? I need my screening pap smear. I need my mammogram. I got my first mammogram this year. It was pretty scary, but after that, I'm like, nope, I need my mammogram, and my healthcare facility was very open, and they're like, yes, this is important because breast cancer is a serious condition and disease and has prevalence in the Black community. So don't forget about those basic things. Please go to the dentist, get that root canal. I think we're far enough in the pandemic that, we have our PPE, we have our plans down to protect everyone. Don't let this coronavirus scare you to the point where you forget about your healthcare screenings and your routine, because that's very important. Because guess what? We're finding cervical cancer. We're finding breast cancer. Yeah, so please go out there and get your vaccine, get a little education, get your vaccine, and then you feel a little safer. Go ahead and continue on with life.
All right. Amen. Thank you, Dr. Kelly. So thank you so much to all of you who are watching. This is another episode of Talking with Dr. Donna. Our goal is to build generational health. And today we are building that generational health by taking care of what I consider to be the backbone of the community, which is women. So happy Women's History Month. Thank you for joining. Remember, every Thursday at 6:30 p.m., you have an appointment with your doctor. So until I see you next week, take care, be safe, and if you're not vaccinated, really, really consider and think about whether or not you want to come on down to TrueVine and get your vaccine. Take care. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel, and subscribe. Remember, every Thursday, keep your appointment.